getting started. Welcome, everybody. This is the second episode of Tot Talks. Last week, we talked about solid foods, and this week we're talking about toilet troubles. So lots of poop talk today. We'll see how it goes. So we're going to wait a couple minutes, obviously let everybody get started on and get clicked on and get settled in, and then we'll get started. Hopefully we will not have any guest appearances by my cat, although it is not looking good at the moment, because here she comes. We'll see. I started these last week, like I said, and so for those of you that are just joining us, my name's Dr. Jean Wagner. I am a pediatrician with A to Z Pediatrics in Caseyville, Illinois. We have two locations, one in Bethalto, one in Caseyville. We have been together with myself, Dr. Eberhart and Dr. McGranahan have been in practice together for about 15 or 16 years, but we've been together as A to Z Pediatrics for almost 13 years now. And we have four amazing nurse practitioners who work with us, Claire, Andrea, Melissa, and Joe. So I think we'll get started. This week I decided to do toilet troubles because I think it's a really, really common and popular question that we get all the time is my kid pooping normal? And there's a huge range of normal. And I think what I'm going to do is I'm going to kind of go through sort of the ages and stages of toilet and poop and kind of what to expect. And then I'm going to go into some pitfalls and then we'll open it up to questions. Let's start out with newborns. And so when babies are born, they have absolutely no control over their bowels. And they also have never absorbed anything into their bodies before. So when they start eating right away, almost everything is just kind of flushing right back out through the system. Not a lot is absorbed, which is part of the reason why they have to eat so often. And it's also why it's mostly liquid when it comes back out. I always tell my patients' moms, liquid in, liquid out. So don't be alarmed when breastfed babies and formula-fed babies for the first few weeks are pretty much shooting out straight liquid for the first couple of weeks. And they're doing this every time you change their diaper. And that, like I said, is because they have no tone really in their rectum. They can't hold it. They have no, what's called being continent. And they are on an all liquid diet, and their little intestines are still not really absorbing everything they need to absorb. So a lot of stuff is just kind of flushed right back out again. Starting around 3 weeks or so, your baby starts to be able to actually absorb a lot more of the nutrients that are coming in. And they start to have more rhythm to their digestion. And so they begin to consolidate their stools. And sometimes this can become superiorly alarming when you have a breastfed baby who maybe only poops every 5 or 6 days. And when they do poop, they poop out like blowout poops everywhere, gigantic liquidy stools. And that is because a breastfed baby, when they're exclusively breastfed, almost all the food is absorbed 100%. So there's just not a lot of waste left over. So there's not much poop to be made because it just, it's all absorbed. So there's no waste. So it may take 3 or 5 or even 7 days for a breastfed newborn to form enough like mass in their colon to actually make a bowel movement. So for the first 6 to 8, for the first 3 weeks, you should have a baby who's having pretty much pure liquid stools and having them very frequently, 5, 6, 8, 12, 14 times a day. And they should not have discomfort. They shouldn't have hard or formed stools. There should never be blood. Now, like straining and turning like 8 shades of purple is completely normal for newborns because they don't have really any abdominal muscles, neither do I. And so they have to like hold their breath. And so they take a big breath and they grunt really hard. And that's kind of how they make a poop. So for the first, 4 to 8 weeks, we expect a lot of grunting, a lot of gas, a lot of what appears to be poor digestion because they aren't absorbing a lot of food. Around 4 weeks, the stool should begin to slow down. It's still going to be pure liquid and they're still going to grunt and strain. And that is going to be that way probably for the first few months. By the time they're about 2 to 4 months, you should have fallen into somewhat of a pattern of soft stools that are like the consistency of like cottage cheese, maybe peanut butter, but not thicker than peanut butter. They shouldn't be like Play-Doh or clay. They can be as loose as like applesauce, but never like pure water after about 2 to 3 months. By the time they get started on food, so between 4 and 6 months, the stool is going to start changing colors. It's going to have a lot of fun, different colors in it. And it may get a little more like consistency to it, but really still should be very, very soft, very easy to pass. Again, maybe the consistency of like peanut butter, or maybe now once you've got them on like regular food, the consistency of what I would say is like cookie dough. So you could squeeze it out of a tube, but it's going to hold its shape. In a diaper, it may appear to be a lot softer because it's like smooshed, in their little butts. So that's normal for a baby. Once they are have reached the toddler stage and beyond, then they really poop like little. Don't know that I'd call it fun colors. You're right; they're probably not super fun colors. It's not pink or anything. It's probably like green and yellow and orange and brown. And so they hit the toddler stage, and now they should be pooping pretty much like an adult does, meaning that it is fairly regular. So once a day to once every other day, maybe twice a day. And it should be pretty soft, like the consistency of like cookie dough. So it can hold its shape, but is not, but isn't harder formed, but also isn't liquid in the toilet. And that is honestly the way everyone is supposed to be pooping for the rest of our lives, although most of us don't realize that. We really are never supposed to have like hard, very formed stools. They should be, hold their shape, maybe a little more formed than cookie dough, but not a lot more. And that's it. That's it for the rest of their lives, every day to every other day, with minimal effort to, hi, Jessica, she works at our office, with minimal effort to get it out. And that's pretty much, I'm not sure if I'll eat cookie dough the same again. I know I have a lot of gross references. So that's kind of the run through really quickly of like what normal should look like. So let's get into what's abnormal and like, when should you call me? So in the newborn period, I would definitely want you to call me if your newborn is having stools that are formed like Play-Doh, if they're super hard to get out. And I did say that straining is normal. However, if it's getting to the point where it's causing a lot of problems for your baby, if it's causing them to throw up, if it's causing them to, shall we say, lose consciousness, I think you know who I'm talking to, then that's a problem, and we should probably hear from you, okay? And so once they get out of that phase and then into, again, like I said, the 6 month and up phase, it's now really mostly going to be an issue of consistency. Frequency isn't as important as consistency, in that I would prefer that they have the soft, semi-formed to formed stools once a day to once every other day. But there are people who only go every 3 days. And as long as it meets those other criteria, the kids are comfortable, they're not having pain, then that is okay. And again, never blood, never mucus. And so that is, that's again, sort of the realm of what I would consider to be what's normal and when you should call me. So if they're straining a lot, a reason, but there can be underlying reasons for it. And in the newborn phase, if you're worried at ever, you should always call. So in newborns, things that can cause them to be constipated can be, maybe we're not preparing the formula correctly. It doesn't have enough fluid in it. It can be thyroid problems. It can be that they, with the mom who's breastfeeding, that she isn't getting enough liquid. It could be medications that the baby's on. It could be medications that the mom is on. Once you get into the phase from 6 months and up where they're pretty much eating food, most constipation is diet related. Almost all constipation is diet related. Not enough fiber, not enough fluids, too much dairy. So between 6 and 12 months, mostly what you want to be doing is encouraging tons and tons of fruits and vegetables, which is what we talked about last week with our last time with the feeding one, is that kids need a ton of fruits and vegetables. And so shooting for about 50% of their diet to be fruits and vegetables will help them get enough fiber. And then also trying to stick with high fiber carbohydrates, whole grains, that kind of stuff, whole wheat, whole fiber in their diet. Once they are off formula, because we never want to limit how much breast milk or formula a child is on, they should always get as much as they want. However, when we transition from a formula breast milk diet to a people diet, and then we're drinking our milk or milk substitute, then we have to really watch how much we get. And we really don't want kids to get much more than about 20 ounces of any kind of milk after they turn 1 every day, because we want them to be eating fruits and vegetables. And so if they are taking more than about 24 ounces of milk a day, that's the first thing I ask when I have a constipated kid. How much milk are you taking? Because that's probably the first thing I'm going to do. And then how much water are you drinking? Because really, that's the first thing I'm going to tell you is cut back on the milk and increase the water. And that's going to be true pretty much from age 1 all the way up until they're 21, is less milk, more water, more fiber in your diet. And so beyond that, then if we're doing those things and we still can't get anywhere, or we've gotten so far behind that we need to catch up, that's when we're going to bring a medication on board. And there are lots and lots of options out there for treating kids who have hard stools and constipation. 99% of the time, we don't use true laxatives. A laxative actually stimulates a bowel movement in your body and actually causes the colon to do its thing and squeeze the bowel movement out. Most of the time in kids, what we use are stool softeners, which are most of the time in the form of some type of carbohydrate or sugar that the human body doesn't absorb, thus pulling water into the colon and flushing the poop out. And that might be lactulose, it might be Miralax. Those are probably the 2 most common ones, milk of magnesia. Their whole purpose is to bring more fluid and liquefy the poop so that it can come out. And that's pretty much how we're going to treat it every time. When would I refer you to a GI doctor? I think if my normal methods are not working after several weeks of trying, I would definitely want you to go see one to make sure we've ruled out any other underlying causes. I think, again, if there are extenuating circumstances to the bowel movement situation, meaning that there's a lot of blood, there's hemorrhoids, I suspect that there's some sort of blockage happening, and a lot of that's going to be something that we would discuss more in detail with each individual case, because the specifics of that are super broad. So that's just kind of a very, very, very quick nutshell version of what's normal versus what is abnormal. I think that one of the biggest things I really wanted to focus on here was that toddler stage of the toilet training and especially the poop training, which can sometimes be so incredibly trying for a lot of parents, including myself. So toilet training can begin really anytime you want. It's really more a matter of how much effort you want to put into it. So I do have a couple, it's the worst. That's what Allie says. Yes, it is the worst. There's a couple of things that I think need to happen before you can say that your kid's ready to be toilet trained. And I think one is they have to have words. They need to know the words for poopy, potty, toilet. They need to have the dexterity to be able to take off their own clothes and put them back on. Preferably, they are sleeping in a big girl or big boy bed, because if they have to go in the middle of the night, they need to be able to get up and out of the bed to go and not have to call for you. But that's not a must, but it definitely helps. So, and then the last thing is they have to understand that everything has a place. So they understand that their blocks go in the red bucket and their Matchbox cars go in the blue bucket. And that, they sort of understand their shoes go here, their clothes go here, because then they understand that poop and potty belong in the toilet and not on the floor and not in my pants and so on and so forth. And so, okay. So those are the things, speech, and then sort of understanding that everything has a place, being able to take their clothes off and on, and then also, oh my God, I just blanked on the last one, but that's okay. We already did it. So here's kind of, those will be the things that I think you should know. And then the last really big important thing is your kid kind of has to want to. And that if your kid has no interest, you're mostly going to be potty training yourself, to put them on the toilet every so many minutes or so many hours. And they may or may not accidentally make poop or potty at that time. And so really you're mostly going to be training yourself. If you kind of let the kid lead the way and let them decide when they're ready, it's going to go smoother and quicker. And that typically isn't going to happen until closer to 2.5 or 3. Now, it is normal to toilet train anytime between about 18 months and 3-ish. Both my kids were a few months over the age of 3, and it took us a few days. If the earlier you try to do it, I think the longer it takes, because it just takes longer for them to learn the process. So there are about a bazillion ways to potty train kids. So I could go on for days. However, I think there are a few really important points, and that is, one, it should never, ever be approached from a negative perspective. In other words, punishment is not ever in any way appropriate for toilet training kids. You never want them to have a negative association with the toilet. Believe it or not, this is very psychological for them, and it's scary, and so, because it's a big change. So we shouldn't ever say, don't you want to be a big boy? Don't you want to be a big girl like your sister? You don't want to be a baby wearing diapers forever, do you? Oh, it's so yucky when you poop in your pants. You're so gross. None of those things are going to help. They aren't going to make it go any faster. Shaming doesn't work. Instead, when they do something you don't want them to do, in other words, they have an accident in their pants or whatever, you don't address it. You just say very simply, uh-oh, there's a mess. Not you made a mess, not you're gross, not you're a baby, but uh-oh, there's a mess. Much like what would happen if your kid's walking around with a bowl of Cheerios or goldfish and they dump them on the floor. We're not screaming and calling them disgusting and making fun of them. We're just saying to them, oh, shoot, well, you probably ought to help. And so we have them come and help them pick them up. You're going to treat poop and potty the exact same way. And so meaning that when they go poop and potty in their pants, it's simply a mess that must be addressed. And that is that rather than letting them just lay down, you clean it all up and have them run about their business, that you have them assist. So as best they can for their developmental stage. So for example, it's summertime. You're going to throw your kid in their underwear. We're going to go outside and play. About every 90 to 120 minutes, you're going to go in and we're going to have potty time. And then they are promptly going to go back outside and pee in their pants. And then all you're going to say to them is, oh, shoot, well, there's a mess. Guess you should clean it up. And you're going to send them back into the house to go get their own undies, their own shorts, take their wet stuff, put it in a basket. And that's specifically for their poopy and their potty stained clothes. And then they have to clean themselves up with a, little wipe or whatever. And if they're in the house and there's any poopy potty on the floor, they have to help clean it up. Again, it will be unsuccessful because they're going to suck at cleaning this stuff up, but that's okay. It's not about that. It's about having them take responsibility for their mess. So in doing so, you are showing them that this mess is their responsibility, but you're not shaming them. And over time, they're going to get really tired of every time they go to the bathroom in their pants, they got to go all the way back to their room, stop what they're doing, put on pants, change everything, clean stuff up. If they poop in their pants, then you need to have them, again, help you take the poop to the toilet, dump it in, they flush it, they watch it go bye-bye down the toilet, they take their underwear and do whatever you're going to do with it. Rinse it out, throw it away, whatever you want to do. And so that they, again, are taking responsibility. They need to help clean up. And then you just keep doing this every 90 minutes to 2 hours for 3 or 4 or 5 days. And generally speaking, if they're ready, they will get it. They will get the whole idea that this is how it works. The reward that you would, and a lot of them will we reward, right? We're going to give them rewards for doing this. But most importantly, I think it's important to reward the behavior and not the result. So yes, it's great that the poop and the potty went into the toilet, but it's just as important that they participate in the behavior of, it's time to go. So we take our pants down and we sit on the toilet and we try. And so what I did was we got a sticker chart. And if they sat on the toilet willingly, you got a sticker. If they sat on the toilet willingly and pee-pee came out, they got 2 stickers. And if they sat on the toilet willingly and poo-poo and pee-pee came out, they got 3 stickers. And they would work their way up in stickers. And every, whatever you determine, 5 stickers, 10 stickers, they get to go to the treasure box. And you're going to go to the dollar store and buy a bunch of junk and put it in the treasure box. And it could be whatever works for them. You know your kids best. So a bunch of junk in the treasure box, and they get to go in there and pick something out of the treasure box. It could even be things like a coupon to decide what we're going to have for dinner tonight, or what the movie we're going to watch, or what dessert we're going to have, or you get to stay up 10 minutes later than your sister. Those kind of things will help keep kids motivated. And so that's kind of the general way that I tell parents to potty train their kids. That's not the only way. There are many, many, many ways to train your kids to go to the bathroom on the toilet. And as long as we're not using shaming and punishment, then it's not wrong. And if it worked, then it works. And that's all that matters, that your kid is going to the bathroom on the toilet. Now understand that everything I'm talking about right now is only to do with daytime, I am conscious potty training, toilet training. When they are sleeping, it is a totally different ball game, and it has nothing. Oh, Grace, I see your question, and I'm definitely going to get to these difficult toilet trainers here at the end. So I know a couple of you have asked me some questions about these really terribly resistant toilet trainers, and we're going to get to those. Okay. So with the nighttime stuff is completely separate, and it can't be related to the daytime stuff at all, because they are unconscious. They don't know what they're doing. And it sometimes takes a few years for that little brain to catch up with that little bladder and then start to recognize the symptoms of having to go in the middle of the night. So whatever method is working for your family, whether that's pull-ups, whether that's bed pads, to keep the mattress dry, until they are ready, and you start to notice that more of their nights are dry than not, then they're ready for that nighttime being toilet trained. But I don't really call it toilet training at night, because it's really just a matter of neurologic maturity and that brain-body connection being made. It is totally normal for kids to wet the bed until age 10. Age 10, yeah. At age 10, 10% of kids are still wetting the bed. So, at our house, we used a combination. I had a mattress pad, a waterproof mattress pad, then the sheet. Then I bought these like fabric waterproof things, and I lined them up this way, and then this way, and then this way, and then this way. And we had a bunch of them on there. And then, if one of them woke up in the middle of the night, they could just pull that layer off, get some fresh clothes, and go back to sleep and not stress about it. If they get to about 7 or 8, so we're getting close to sleepover age, and it's still a problem, then bring it up at your well check, because there are some things that can be done, but it's way too in depth to talk about in a discussion like this, okay? And it definitely involves some more personal for each individual child based on their medical needs, okay? So it looks like, I think what a lot of people really want me to touch on are those resistant toilet trainers, which is so common. And understand that the majority of what I'm talking about is mostly dealing with what we call like our neurotypical kids. So that means kids that don't have developmental delays, that don't have autism, that don't have neurologic disorders, chromosomal abnormalities, any of those kind of things, because when those things happen, it's going to change the game. And again, these rules will work, but they may work later. And it may take a little bit older, or in conjunction with a therapist or things like that. A child that's had a lot of trauma, sexual abuse, things like that, these rules are not going to apply, okay? These are for healthy kids who are developmentally, what the heck, developmentally typical. And so that's what these sort of tips are for. Hold on, I'm looking at this comment right here. Okay, yep, I think almost everybody is really, really interested in how do we get kids to do this. Okay, I mean, it's not that different from what I just talked about, which is you have to, you really have to make it their idea, and it really has to be, that it has to be inconvenient for them to not use the potty. So in other words, when you take a typical kid, if you make something easy for them, that's the route they're going to go. Kids are always going to take the path of least resistance. It is their nature. So they are not going to do things that are hard for them. They are not self-motivated like adults. So there has to be some external force that's going to make this happen for them. So I think that if your kid has gotten to age 3 and they are showing zero interest in going to the bathroom on the toilet, then I think that you ought to, number one, is take about and especially if you've spent the last 2 months just knocking your head against the wall and, and getting to where the kid is frustrated and you're frustrated and everybody's on your back, just turn everything off for 4 weeks. We're not talking about it. We're just going to use the diapers. We're going to put the potty away. We're putting the books away, all of it, nothing. And we're going to take a 4-week break. And then we're going to bring it all back out. And when we bring it all back out, you're going to make the decision that the pull-ups and the diapers are gone and we will no longer use them. And when you've gone to that point, it's the point of no return. If you've gotten to the point where you're like, okay, this has to happen. My kid's going to preschool, or you're 3.5 and this is ridiculous. Then this is the kid I'm talking about. Okay. And so you've given your month break. Now we're going to come back to it. And every diaper, pull up, whatever you have is gone, because those are crutches. And when a kid wears a pull up, it's a diaper to them. They don't know the difference. Even though you and I think it looks different, it feels different. It doesn't feel any different to them. It pulls away wetness, so they don't feel it. They have no idea that they're wet. There's no discomfort in being wet in a pull-up. So that's why you've got to put them back in the underwear. So pick a day. This is it. We're done. Summer's the best time because I would highly recommend you be outside when you do this. And then you are going to just get the chart and you're going to tell them, okay, no more diapers. I'm sorry, they stopped making them in your size. Or you can throw me under the bus. Dr. Wagner said that you can't wear them anymore. I'm sorry. That's what she told me. So everything has to be cool as a cucumber. We're calm. We're not upset. There's no pressure. You don't care if they go at all. You don't even care. Whatever. Just whatever. So, but I'm sorry, the diapers are gone. Oh, they're out of stock. Oh, well. So that's exactly how you're going to say it. And then we're going to go play and we're going to have fun and we're going to do some super fun stuff. But that potty timer is going to go off in 90 minutes. You're not telling him to go. The potty timer is telling him to go. And when it goes off, ding, 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 you're going to be like, oh, did you hear that? That's the potty timer. Well, that means we all have to go potty. Everybody in the house. So whoever's at home, everybody in the house marches to the potty. Everybody goes. Kid who doesn't want to go takes his turn. And you tell him, all you got to do is sit on it. I don't care if you go or not. You just have to sit on it. And if you sit on it, I'm going to give you a sticker. And if you get 5 stickers, you go to the treasure box. So you put the chart on the wall. He sits on the potty. Nothing will happen because he's going to be like, this is stupid. I'm not doing this. So he's going to sit there. And then he's going to get up and go play and pull his pants back up and run back out and promptly pee on himself. And that's okay. Because then, like we said before, you're going to look right at him and go, oh, shoot. Well, looks like there's a mess. Guess we should clean it up. So you're going to send him back to his room, get his pants, brand new undies, brand new shorts, have him throw everything in a basket. And then he has to do the wiping and cleaning and whatever spills there are, yada, yada, yada. And then the timer resets and then you go back outside to play and the timer goes back for 90 minutes. 90 minutes happens again. The timer goes off and you are going to come back to the potty and we're going to sit on it again and we're going to get another sticker. After several days of this, hopefully at some point they accidentally have oh, hi, this is my cat. Say hi, Minnie. they will accidentally have a potty on the potty, and then we're happy, but we don't make a huge big deal over it, okay? Because if we get super, super excited, like, oh my God, this is the greatest thing ever, and now you get a brand new car and Barbie house and all this stuff, you've overplayed your hand. Then you've put too much pressure on them, right? That's the pressure, and they are gonna push back at you. No, I'm not gonna do what you want me to do. So basically the routine is potty timer goes off, we sit on the potty, we get a sticker. Potty timer goes off, we sit on the potty, we get a sticker. When we get 5 stickers, we go to the treasure box. You could care less if pee-pee goes in the potty. You don't care. But every time there's a mess, guess who's cleaning it up? Little Aiden or Michael or whatever, whoever you're. Okay, so we are back, and hopefully what stinks is that all the questions are gone. Shoot. So if any of you had questions, type them in really, really quick. I have nowhere to be. So, I mean, I'm literally at my house. I mean, I have time. If you guys have, I will wait a few minutes and let you guys ask any questions that you have. Hi, Whitney. And so, but I think where we were was I was finishing up kind of talking about the toilet training and kind of how to deal with kids who don't want to do it. And so, oh, those are both good questions. Okay, so how long do we make them sit on the potty when they are, when we're doing this little training thing? I think no more than 10 minutes or less, because they don't have that long of an attention span. And so I certainly, you don't want them sitting on there for a really long time. It's not super comfortable, and it can promote straining. And so make sure it's comfortable. Those are some other tips that I didn't even think about, is that make sure that their feet can reach the ground, and that they, that you can use like a little stool or those, what are those things called? The squatty potties. And so that, so that they're comfortable. So no more than about 10 minutes per try or less. As far as, does your poop seem to change when it's teething? Yes, it actually can. While teething, I think, is kind of over dramatized a lot. Most pediatricians agree that it doesn't cause high fevers and it doesn't cause ear infections, but it can change their stool and make it a little more runny. It should not create overt diarrhea, where they're having like loose liquidy stools multiple times a day, because if that's happening, it's probably some kind of a viral bug and you might just want to call us. But, having a little bit of a looser texture to the stools with teething, I think, is totally, totally normal. Let's see what other questions we got. So do we have them wear underwear or not when they're potty training? Yes, my recommendation is, when you have made that choice to cross over the line and you're never going back, you throw the pull-ups and the diapers away. Now, naked is fine, or with their underwear. One trick for emergencies, especially if you have to go somewhere and you're not quite ready for them to be out in the world in undies, is to put the underwear on first and put the pull-up over the top of it. So that way they feel the wetness. They often don't want to wet their or soil their cute new undies. And then, but the pull-up will contain a lot of the mess. They do also still make the old school, waterproof pants that go over underwear, which is not a bad choice when you're really desperate and you need them to learn how to go. But the pull-ups and the diapers, they don't get the sense of needing to go because they just don't feel the wetness. Do I think switching to pull-ups from diapers is worth it? No, I really don't. I think that, like I was just saying, that in a pinch, they're nice to have for emergencies, but overall, pull-ups don't help you potty train because they just feel like diapers to the child's butt. They don't know any different, and it absorbs the pee and the poop as good as a diaper does. So there's no motivation there for them. There's no discomfort in their pants. So, but doing some underwear under the pull-ups is not a bad idea, or under the diaper is not a bad idea. So Jennifer's asking me, what if they even refuse to sit? We've tried 3 different times and 3 different potties. He's now staying dry at night and tells us when he's wet and poopy, but he still is refusing to sit on it, huh? Once every 2 days, sometimes 3. Okay. So Jennifer, Oh, two different Jennifers are asking two different questions. Sorry. Okay, so Jennifer, with regards to you, if he's refusing to even sit, if he's under 3, I would leave him alone until he's over 3. That's the first thing. The second thing is if he's over 3, what I would do is just leave him alone for a couple of weeks again. And then if he's wearing pull-ups or diapers, throw them in the garbage and just go with the underwear and go through the process that I recommended of having them be responsible for the mess. That is honestly my best advice. I know I sound like a broken record, but seriously, that is really the best advice, and it will work. Oh, it looks like she answered me. Jennifer, you said that, oh no, where did it go? So, and then as far as like, after you've toilet trained, it's a common time for kids to get super constipated because they start kind of going through this fecal holding phase where they don't want to poop. Maybe they had a painful stool, or maybe they had a bad experience on the toilet. If they are not pooping at least every other day, especially if the stools are really hard or formed, I might consider putting them on a little prune juice or a little Caro syrup to help with keeping the stools really soft for a older child, maybe like 2 ounces of prune juice once or twice a day. And that's something we didn't talk about either as far as treating constipation in babies, but I don't think that's as big as a concern for you guys as the toddlers, because it's awful. What about a child that is aware they need to go but refuses to sit up on the potty, and they clean up their mess and all that, but no problem, but just refuses the potty? Well, shoot, Allie. Is she she's under 3, right? I think, Allie, is she older than 3? I don't remember. You're going to have to help me on that one. Grace, I love the idea of just letting them go naked. I think that's fantastic. And if you don't mind cleaning the mess up off the floor, then, or if you have a private backyard and you're not going to have a bunch of people seeing your naked babies, then yeah, naked is great. Please, nobody take that in isolation and steal it. Please, please, please don't do that to me. I just realized naked is great. So, I mean, it is. Naked is great. So, Jennifer, he turns 3 in September. Okay, so back to Jennifer's question about that they've tried multiple times and they're just not getting anywhere. If he turns 3 in September, then obviously he's like 2.5. He just may not be ready, Jennifer. He just might not be ready. I would give him a break for a couple of months until he's ready, and maybe wait until summertime and then try the process that I described to you and see if that works for him. Just take the pressure off you guys for a little bit and just let it go. You've tried a couple times. He's not interested. You've tried 3 different potties and all this stuff. It just sounds like maybe he's just over it. And he doesn't want to talk about it anymore. And so let him alone and maybe even give him 2 months and just stop talking about it and go back to my suggestion of you don't care. And he's going to be shocked that you quit talking about it. And he'll probably be glad that you stopped talking about it. So just leave him alone. And maybe this summer, let's try to run back to it again and see how he does then. Allie, nope. Allie, did you just say she's over 3? She's over 3. Darn it all. I mean, I think if she's over 3 and she's that resistant and she's basically just going in her pants and then cleaning it all up, I guess my question to you would be, how long has she been doing that? And maybe we just need to give it more time. But also, since I know you work in my office, then maybe we can talk about it more when you come in, because I think I need more information. And then Abby said, potty trained, but doesn't often poop. She becomes constipated, then that steers her away from the potty. Yeah, Abby, you're exactly right. So when they get even the hint that something might be wrong with going on the toilet, and there's even the hint of something amiss, they run the other way. And this is so common that if you've ever studied psychology and you've heard of Sigmund Freud, he called it the anal retentive stage. And that's because they hold their poop all the time. And this is when it's good to bring in stool softeners and you sort of force the poop out so they can't poop hold. The worst thing you can do, not the worst, but I mean, one of the big contributors to having difficulty poop training your kid is that they are constipated and they don't want to go on the toilet because it hurt once, and therefore in a 3-year-old's mind it will hurt forever and ever and ever and ever. So you have to backtrack and get them to do some nice soft, get them to where their stools are nice and soft, easy to pass with no problems, and then retry. So that they kind of forget about all those times when it was hard and uncomfortable. And so, Abby, I would maybe talk to your pediatrician about some suggestions for stool softeners. I don't want to make a blanket statement because, again, every kid has individual medical needs, and I don't think I should be giving out like specific medical advice on here, as much as I would love to help you. But if you come to our office, just give us a call, and we can either do something over the phone or bring her in or talk about it at our next well check and give some really specific ideas on how to help her with constipation. Scrolling. And then, so you've got Eileen, you've got 3 to 4 days to do some potty training, and then he has to go to daycare. I would do, if the daycare's willing to let you do underwear with the pull-ups over the top, and he's raring to go and you're raring to go, then I'd say give it a whirl. If it doesn't work, then stop for a few weeks and try again. Not every kid's going to be successful the very first time that they potty train, the very first time you try to potty train out of the gate. And so some kids take a couple tries. So Eileen, if you maybe try it for 3 or 4 days, and then he's got to go back to daycare and he's not ready, then see if they'd be willing to do the pull-ups over the underwear. If they're not, then interestingly enough, kids are smart enough to understand that different locations have different rules. We all are smart enough to understand that. That's why they behave better at school than they do at home. And so he'll understand that at school I get to do it this way, and at home I have to do it this way, until he eventually gets it, if they aren't willing to go with what you need to do. And cool. You're welcome, Abby. I think we kind of answered everybody's questions. Hopefully, we've gone through some good stuff. Again, just to end, I'm Jean Wagner with A to Z Pediatrics. I am going to be doing this hopefully every 2 weeks. 2 weeks from now, I'm going to talk about sleeping or not sleeping, which is what most of us are doing, and give you guys some tips on how to get your kids to finally sleep. And I really wanted to call it Go the F to Sleep, but I decided that might have been a little bit unprofessional, so I just called it Go to Sleep. But I mean, seriously, would that not have been the best title ever, is Go the F to Sleep? Because it's the name of a book. I don't know if you've ever heard it, but it's a fantastic book. So anyway, I'm done. You guys have a great evening. Stay safe. I think it's supposed to get yucky out there tonight. And as always, call us if you have any questions. I really enjoyed this. And you guys had some awesome questions. So, stay well, stay safe, and I will see you guys in 2 weeks. Thank you so much. Bye-bye.